in its own right. So there's physios and OTs that get trained as hand therapists. Okay, so it's very complicated. The hand has so many joints, and it's capable of all of these kind of very fine motor movements. So hand therapy is an area unto itself. I'm going to talk to you a little bit about the hand, but Siri in second year has a whole section on hand therapy. Okay, she's done quite a bit of hand therapy herself. So I'll just give you the basics, and you guys will hear more about it. Okay. So, do you guys remember what the last joint of your finger's called?
The phalanges, isn't it?
It is, but the joint is the distal interphalangeal joint, or the DIP. Okay. Second one, this is the PIP, right? The proximal interphalangeal joint. And then we have the MCP, which is the metacarpal phalangeal joint. Okay. The thumb, of course, has only an interphalangeal joint, right? Because it's only got one. And then it's got the MCP joint. So it doesn't have a PIP-DIP. Okay, there's only one joint there. So at the DIP and the PIP, there's generally only flexion and extension available. Okay, so it moves in a single plane in the sagittal. If we're in this position, it'll be in the sagittal plane. Right? Flexion, extension kind of occur in a sagittal plane. So for these two joints, we only have to worry about flexion, extension. The MCP also has abduction, adduction.
Is there extension with those ones or no?
Yep.
With the MCP?
Yep. There's extension and there's flexion as well. And then there's ab and adduction on top of that. So all the finger joints flex and extend, but the MCP will also abduct and adduct. Okay, so when you're doing range of motion, you have to keep that in mind. And then the thumb's kind of special because it's rotated, instead of being in the same line as the hand, it's rotated around so we can do opposition, right? First of all, there's flexion extension of the IP, MCP, but the most important function really that the thumb has is opposition to the other digits. Okay, that allows us to do all sorts of things. So when we're doing this, it's best to be just methodical. Maybe start with the index finger, start with the DIP. You're going to take it through full flexion, full extension. Okay, and you're going to, just like any other joint, you're going to do a few repetitions. Okay, and notice how I'm holding on either side of the DIP. I'm not trying to hold up here, right, because that's going to get kind of wonky. Okay, I'm making sure that I'm on close to either side of the joint. Okay. Then we're going to move down to the, like, look at the amount of range, right? So
that's just, she's not even wincing.
No. So that is her flexion, and that's her extension. Okay, again, I'm trying to stay on just on either side of that joint. Okay, I'm going to do a few repetitions there. Then I'm going to move down to the MCP. Okay. Okay. And once I get down to the MCP, I have to remember that there's abduction, adduction. Okay, and then I would simply move to the next joint and repeat all the same things. The DIP, the PIP, okay, the MCP, okay. With the thumb, so we'd move across the whole hand that way. With the thumb, we're going to do IP flexion, IP extension. I'm only showing you a couple repetitions of each, but of course you do about 6 or 8 or more. Okay. Doing this joint. Okay. And then opposition actually occurs at the carpal-metacarpal joint. Okay. So it's a joint between the first metacarpal and the carpals, okay, the scaphoid in particular. But what you would do is you would cross across the palm. So you bring the thumb usually to opposed to the base of the fifth tarsal. You okay there?
Yeah.
I think having somebody else move your hand for you. Okay. So those are the basic movements of the hand. Okay.